First Aid for Skin Exposures, a comprehensive guide to thermal and chemical injuries. Accidents involving hot liquids, sizzling oils, or corrosive chemicals can happen in a heartbeat, whether you're draining pasta, repairing a car, or cleaning the bathroom. In these critical moments, the actions you take within the first few seconds determine the severity of the injury and the length of the recovery process. While putting butter on a burn is a common old wives' tale, modern medicine provides much more effective and less greasy solutions. Here is your definitive guide on how to handle skin exposure to hot water, oil, and chemicals. 1. Scalds, hot water and steam. A scald is a burn caused by hot liquids or steam. Because water flows, scalds often cover a larger surface area than contact burns, like touching a stove. Immediate actions. Stop the heat source, move away from the steam or boiling water immediately. The 20-minute rule, run cool, not cold, tap water over the affected area for at least 20 minutes. This stops the cooking process of the skin layers. Remove jewelry and clothing, do this quickly before the area starts to swell. If clothing is stuck to the burn, do not pull it off, cut around it and seek professional help. Cover loosely, use plastic wrap, laid over, not wrapped tight, or a clean, non-linting cloth to protect the area from infection. What not to do? No ice. Extreme cold can cause ice burn and further damage the tissue by restricting blood flow. No ointments yet. Avoid butter, toothpaste, or heavy creams. These trap heat inside the skin. 2. Hot oil burns. Oil burns are particularly dangerous because oil has a higher boiling point than water and is viscous, meaning it sticks to the skin, continuing to burn long after the initial splash. Immediate actions. Cooling is key. Just like water burns, use cool running water for 20 minutes. Degreasing, gently. If the oil is still coating the skin, you may need to use a very mild, fragrance-free soap to break the oil's surface tension, but only if the skin isn't peeling. Assess the depth. Oil burns are more likely to cause second-degree, partial thickness, burns, characterized by blistering. Pro tip: if the burn is on your face, hands, feet, or genitals, or if it is larger than the size of your palm, go to the emergency room immediately. 3. Chemical burns. Chemical burns are the silent burners. Unlike heat, chemicals can continue to react with your skin proteins until the substance is completely neutralized or removed. Identification. Acids, e.g., battery acid, bleach, usually cause immediate pain. Bases/alkalis, e.g., drain cleaner, oven cleaner, are often more dangerous because they don't always hurt immediately, but they liquefy tissue, allowing the chemical to penetrate deeper. Immediate actions. Brush then flush. If the chemical is a dry powder, like lime, brush it off with a cloth first. Adding water to some dry chemicals can cause a heat-generating reaction. The long flush, flush the area with cool water for at least 20 to 30 minutes. For alkali burns, you may need to flush even longer. Strip down, remove all contaminated clothing and jewelry. Check the label. If possible, identify the chemical for the medical team. Do not attempt to neutralize the burn with another chemical, e.g., putting vinegar on a bleach burn, as the resulting reaction can create intense heat. The recovery phase, do's and don'ts. The golden rule of blisters. Never pop a blister. A blister is nature's sterile bandage. Once you pop it, you open a doorway for bacteria, like staph, to enter your bloodstream. If a blister pops on its own, gently clean it with mild soap and apply an antibiotic ointment. Pain management. Over-the-counter pain relievers like ibuprofen or acetaminophen can help manage inflammation and discomfort. When to see a doctor. Seek professional medical attention if the burn shows signs of infection, fever, increased swelling, or green/yellow pus. The victim is a child or an elderly person. The burn was caused by high-voltage electricity. The pain gets worse instead of better after 24 hours. Summary checklist. Cool with running water, 20 minutes. Remove restrictive jewelry/clothing. Cover with a clean, loose dressing. Consult a professional for any chemical or deep thermal injury. Being prepared doesn't just save skin, it prevents permanent scarring and life-threatening infections. Stay safe, and keep your kitchen and workspace well ventilated and equipped with a proper first aid kit.